My name is Yvette Villarreal, and I am going to be a speech-language pathologist. I am currently a second-year graduate student at UT Health San Antonio, pursuing a master's degree in Communication, Sciences, and Disorders, with an expected graduation of May 2021. I grew up in Brownsville, Texas, which is a small city that borders Mexico. My parents came to the United States in hopes of a better life. My parents taught my siblings and I, from a very young age, to value education, which is why I decided to leave home and pursue a professional degree. I left my family to attend UT Austin, a university with infinite opportunities. I studied hard and obtained admission to the graduate program of my dreams, UT Health. It is at this institution that I have seen my dreams come true. But it has come with a substantial price. I am working 2 jobs on campus to help make ends meet, and have accepted loans to help cover the cost of my education. I know once I graduate, a good portion of my paychecks will go towards paying off the debt I have incurred. But I find comfort in knowing that I am doing what I need to do to make a life better for a patient. So what exactly does a speech-language pathologist do in healthcare? Well, we are health professionals who assess and treat communication, cognition, and swallowing across the lifespan. We get to help patients think, talk, and eat, 3 of the most important things we do every day. In the hospital settings, you can find speech-language pathologists just about anywhere. We are in the NICU units, feeding babies. In the pediatric unit, helping kids communicate, eat their favorite foods safely, and socialize. In the acute, inpatient, and cancer centers, we assess attention, memory, concentration, voice, and swallowing, and determine what a patient's best plan of care is. We are with the patient in every part of the rehabilitation process. We provide swallowing therapy to patients so that they are able to get their neck muscles stronger after maybe being intubated or after having surgeries that have altered the swallowing mechanism. We provide voice therapy to patients who have undergone surgeries, neurologic conditions, or anatomical abnormalities that have altered their voices. We are constantly advocating for our patients and giving them a voice that they so desperately need. I have learned all of this, but I have not forgotten where I come from. Coming from an underserved, underprivileged area, my plan is to go back to Brownsville and raise awareness, as people are typically uneducated to different diseases and the care that they need to survive. In 5 years, I see myself obtaining all the certifications and obtaining different mentors so that I can learn and be a competent clinician. In 10 years, I see myself back in my Brownsville community, giving back to the community that has given so much to me. I want to teach rising clinicians as well as patients about the care that they need and how to live with the conditions that they have. I want to provide the compensatory strategies. I want to provide the hope that these patients so desperately need. I wake up every day ready to learn and go to my clinical rotation site to serve the community. It is because of the patients I see every day and the happiness they share with me once they're able to get a speaking valve placed and say, "I love you" for the first time after being intubated for 3 weeks, or the first time they are able to take a bite out of that French fry that they so desperately craved. I want my impact to be that of education for patients. I want patients to know that a stroke will not take over their life, that their child being premature does not mean that they will never be able to eat by themselves. I want my patients to know that they are not alone. I am lucky to have found what I love to do, and I am excited to keep sharing what I am learning and making a difference in the lives of the patients and caregivers I see every day. Thank you.